Okay, Kevin, we're just getting started on the left shoulder here. We're looking in from the back to the front. Everything that you see is magnified about 30 or 40 times on the screen. And we're going to start by looking at the biceps tendon, which is that strong cord right there. The biceps anchor is one of the areas we're worried about. And so we were talking about the tenodesis, and this, you can see how this does lift off right here, how that's torn. And so I do think we're going to proceed with the tenodesis here today. Try and get you back a shoulder that doesn't bother you as much. What concerns me right now is this rotator cuff tear. And what we're doing is we're just backing out the cannula. We're going to come down below. Come down here. Stand right here, hold the camera. And so this is the area of the rotator cuff that's torn. If we don't have a burr, we need one. And so this is a rotator cuff tear right here. And how much of it is torn is what we're trying to determine right now. But we can see the defect right there. Okay. So what we do with that depends on how much it's torn on the other side. We'll go ahead and take a spinal needle and a shuttle relay right now and show you how we pass kind of a marker stitch across in just a second. Okay, just hold the camera. Let me see a grasper, please. So the main thing we're doing now is we're just passing a black wire through that spinal needle. It's called a super shuttle. Just hold real still. And we're going to go ahead and retrieve the wire here. We'll back the needle out. And now we're going to load a hi-fi suture on this wire. Vern, you got to stay here. Can't look back. If you look back, this whole thing goes. No. So, okay, so we're just loading the suture in. And we're pulling back on the stitch. There you can see the first pass. And so now we'll go ahead and take the spinal needle again. And we're going to pass that black wire through it one more time in just a second. That's pretty good. I want to get on the other side of the tear, obviously. And I think that's on the other side of the tear right there, so maybe a shade too much. Okay, I'm happy with that. So we're going to pass that black wire through again. Again, this is called the super shuttle. In a minute, we'll get the grasper like we used before. Okay, and then we'll reach in and retrieve it again. Good picture right there, and then we'll go ahead and pull back. And so now the trick is we're going to load the other end of that suture. And that, you can see how that gives us this kind of ripstop stitch across the tear right there, okay? That may be all we have to do. Whether we do more than that depends on what it looks like on the other side. But right now, that looks pretty good. Let me take a pair of arthroscopic scissors, please. We're going to release the biceps now. And like we talked about, we're going to tenodese that through a little incision in your armpit. So now the biceps is released. I'm going to clean up the edges with a shaver just to make sure there's no labral injury to worry about in the future. And we're just about, hold the camera there for me, Vern, please. Great. We're just about done inside the joint here. And now that the biceps isn't attached, this should not be a source of symptoms anymore. Okay. Let's see back here, Vern. Lift up on the shoulder for me. If I can get there, I will. So now we're just looking back here. There's a little bit of tearing in the labrum back here. I'm going to rotate down. And you can see how quickly we can just use our shaver just to debride that. And that should be enough there. Okay, so we're going to finish up inside the joint. These are just some little wear and tear areas on the cartilage of the glenoid. Lift up one more time for me. Okay, good. So we'll go off on the video, show you some more in a little bit. Okay, so here's our sutures that we passed. Remember, this on the articular side is where the tear was, so that if we tie that, that's going to seal that tear over. We're going to raise the arm up and just make sure that there's nothing lateral to that. So as I rotate the arm, the insertion of the cuff, both posteriorly back here and anteriorly, looks pretty good. So I think that was just a partial tear. And I'm going to go ahead, sorry about that, I'm going to go ahead and hold the camera there. I'm going to go ahead and tie this suture, knot pusher, in a mosquito. And hold right here. We will tie this to give this a chance to heal and to make sure it doesn't progress. So we'll show you some more in just a minute. Okay, so we're just making sure we've tied the suture for the cuff. You can see it there. Again, that's just functioning as a ripstop stitch where we identified that area of partial tearing. We've taken off some bones, so we've done what's called a decompression here at the top of the screen. We've already done it. We can just check our work here. We did not have to remove a lot of bone from the undersurface of the acromion, which was encouraging. That anterior cannula coming in right here. So you can see where we're at. So I'm happy with the way that looks. The rest of the surgery is doing that biceps tenodesis, so there's no video for that part because we're going to be outside the shoulder. But everything that we've done so far looks real good. A little bit of arthritis in the joint, not bad. A little partial tear in the cuff, but again, not bad. And now we can get to work on securing the biceps. Okay, so good luck to you now. Bye-bye.